On behalf of the UCSF Institute for Global Health Sciences, Open Consultants Berlin, and the Global Climate and Health Alliance, I'm really thrilled to welcome you to this session on financing for climate change and health. And it's been great and a little surprising to see the interest in the topic of finance, so that's wonderful. As everyone here knows, and as recent events make abundantly clear, climate change is bringing devastating harms to health and well-being for communities around the world. And one thing holding back action on climate is money. A lack of finance is a really crucial missing piece in addressing the health threats of climate change. And the shortfall in finance is striking. According to the IPCC, developing countries will need over $120 billion in adaptation funding each year by 2030, and almost $300 billion each year by 2050 to adapt to climate change. And right now, we're spending just a fraction of that, less than $50 billion. And to reach mitigation goals, climate finance will need to increase 3 to 6 times over the next decade. And of course, any of you who work in health systems know that health is also chronically underfunded. But the challenge isn't just about how much financing there is, it's also about how that money is spent. And the way international finance currently works, funding for climate change and health is really slipping through the cracks, where climate funds are not prioritizing health, and health funders are really not prioritizing climate. This is a huge missed opportunity because if made wisely, investments in climate adaptation and mitigation can have enormous health benefits, and health investments can do much to build resilience and reduce emissions. And right now, these financing structures just aren't well set up to deliver on that kind of mutual goal. And so that's what we're going to be talking about today. Why isn't there more funding for climate and health, and what might we do about it? We're going to start with a very brief presentation by myself and my colleague Marco Schaeferhoff, who will be sharing the findings of some recent research we did on the current state of climate and health finance. And then we have an amazing lineup of speakers. We're going to get to hear from funders and from advocates on what opportunities there are to bring more synergistic finance to the table. And we will have a chance for Q&A, so get your questions ready and feel free to put them in the Q&A box throughout the event. And with that, I'm going to turn it over to my colleague Marco from Open Consultants Berlin to get us started.
Brilliant. Hi, everyone. Thank you very much, Naomi. Naomi, could you put on the next slide, please? Brilliant. Thank you. So I will quickly walk us through the key results of our new study. So let's start with definitions. So we define synergistic finance as health finance that integrates climate adaptation and mitigation goals, and climate finance that addresses health needs and goals. Next slide. We focus on 4 key questions in this study. To what extent do health funds adopt a climate lens and climate funds a health lens in their finance? To what extent does official development assistance, ODA, for health benefit climate and ODA for climate target health co-benefits? What are the main barriers and opportunities for leveraging more synergistic financing? And what role can technical agencies and other stakeholders play in fostering synergistic investment? To answer these questions, we have performed a document review, key informant interviews, and a database analysis. So the first part of our analysis is an assessment of 6 multilateral funds, 3 from the climate sector and 3 from the health sector. So for health, we have the Global Fund to Fight AIDS, TB, and Malaria, Gavi, the Vaccine Alliance, and UNITAID. From the climate space, we have the Adaptation Fund, the Global Environmental Facility, and the Green Climate Fund. This slide shows our research framework. So we assessed these funds along 5 dimensions: mandate, strategy and policy, funding approach, country-level partnerships, and then synergistic investments. Next slide, please. One back. Thank you. So let's start with the mandates. So this is an interesting finding because the mandates of health and climate funds offer different degrees of flexibility for cross-sectoral investment. So for the global health funds, we see that these have focused mandates which to some extent limit investments in climate-related projects. For example, the Global Fund and UNITAID focus strongly on ending AIDS, TB, and malaria. Gavi is focusing on expanding access and use of new and underused vaccines. So clearly, there is a very clear focus of these health funding mechanisms. But at the same time, we think that there is still substantial potential for synergistic investment in health and climate through disease-specific funding, through funding for health systems, through emergency funding and other funding streams. For the climate funds, let's stick with the others, with this one. Thank you. For the climate funds, the story is a little bit different because here we see that these funds have very flexible mandates that would allow large-scale direct investment into the health sector. But overall, as we will show in the next slides, there is a lower organizational focus to integrate health in climate mitigation and adaptation programs. So let's start here with the health funds. So health funds are integrating climate in organizational strategies and policies. On the right side of the slide, you can see the cover pages of 2 recent strategies. So for example, UNITAID's new strategy includes 4 strategic principles, and 2 of them refer directly to climate change. For the Global Fund, again, the most recent 5-year strategy also refers to climate change as a sub-objective for its work in malaria, integrated health systems, and pandemic preparedness and response. So these are clear examples of strategic awareness. At the same time, we find that the health funders have a lot of quite a strong emphasis on reducing secretariat emissions and the greening of supply chains through pooled procurement. So these funds procure health commodities for billions of dollars each year. So there's a substantial impact that these funds achieve through their procurement policies. However, for the most part, we found that the climate efforts are focused on these secretariat level operations, and we find that specific climate related goals and performance metrics remain at that secretariat level. So they aren't yet driving the integration of climate change throughout the fund's operations and investments. And here we think is a lot of potential. Next slide. So in contrast, there is less strategic focus on health within the climate fund. So the Green Climate Fund includes health in one of 4 results areas for adaptation. This is called health, water, and food security. The 2 other funds, the adaptation funds and the GFF, mention health throughout their strategies, but they do not include specific priorities for health. So for example, the GEF has a strategy which is called Healthy Planet, Healthy People. It clearly identifies the interlinkages between human and environmental health, but health is no focus area that determines the allocation of funding. So here is some kind of disconnect, and overall we find less strategic emphasis on health. Next slide. A common finding is that we feel that there could be stronger cross-sectoral guidance to country partners from both climate funds and health funds. So guidance on cross-sector integration is critical to translate strategy and policy into investment directions, and the health funds have started to integrate climate in their guidance. So for example, the Global Fund, check out the Global Fund guidance for TB, resilient sustainable health systems, malaria. These refer to climate change, as do other Global Fund guiding documents. For the climate funds, the same thing. We see that the Green Climate Fund has released a health sectoral guide that emphasizes climate resilient health systems that came out in September 2022, so fairly recently. But overall, we think that there is too little specificity on how to bring climate health considerations into funding proposals and projects. So we think there could be more additional and more specific guidance. And some funds do not provide any guidance and or knowledge or learning materials to facilitate more synergistic investment. Next slide, please. So this is quite an important slide because it shows three closely interconnected dimensions. So on the right bottom, the demand generation at country level is really critical, because countries are, of course, in the driving seat. They develop funding proposals, they submit funding proposals, so they define their own priorities. At the same time, we find that there is a need to provide more technical assistance to build stronger cross-sectoral capacity in country, to really break down the silo mentality. So, for example, that health is included in NDCs and NAPs, and that if they are included in country plans, that they are also including funding requests. And the same can be said for the health sector. So climate considerations need to be reflected in national health strategies and funding proposals to the global mechanisms. That requires more cross-sector expertise and awareness across levels. So global, regional, country, local levels. There needs to be stronger cross-sectoral participation and expertise. And then finally, and that is critically important, especially for the climate funds, so accredited agencies are critically important to get money from the Green Climate Fund, the GEF, and the Adaptation Fund. But at this stage, there are essentially no health organizations being an accredited agency. And so WHO is the only exception for the Green Climate Fund. It's a readiness partner. But overall, this is quite an important gap, because without accredited health agencies, these funds won't provide any funding to the health sector, or only very limited funding. Next slide. So to create country demand, to enable more funding, it's critically important that other actors also play a key role. So technical agencies are critical to build awareness, to provide technical assistance, to build project pipelines. Multilateral development banks and bilateral donors are often cross-cutting funders, so they can fund synergistic projects. Philanthropists and civil society are also critically important for advocacy and agenda setting, but also to fund proof of concepts and research. Next slide. So this is on synergistic financing, and I think one of our key points really is that there is growing strategic interest, but this interest has yet to translate into significant levels of synergistic investment. As mentioned enough, the global health funds have started to invest in climate and health through their principal country grant mechanisms, through emergency funding and other special initiatives. But at this stage, this funding remains rather limited. But we see that we make the case that there is really substantial opportunity to invest in low carbon health systems, to tackle climate change through disease-specific programs. Precondition for that is, of course, that these funds are fully replenished by their donors, so that they can finance climate-related objectives within the scope of their mandates. So for the climate funds, we see very little direct investment in the health sector. So the GCF has no project specifically in the health sector. There was a recent evaluation that shows that the health sector investments through the adaptation fund close to zero, and also the GEF, less than 2% of its projects were directly focused on the health sector since 2001. Next slide. So I'll be very quick on the bilateral financing. So we also assess the bilateral financing to complement the work on multilaterals. And I'll be really quick. So here, what we can see here, and the method that we used is the official method by the OECD, which is based on the so-called policy marker. So, but this method suggests that much of the adaptation funding comes from agriculture, water, environmental protection, transport, and storage, and that only maybe 2% of adaptation ODA is channeled through the health sector. Next slide. And the situation is even more bleak for the mitigation ODA. Here we find that clearly less than 1% of all mitigation ODA is channeled through the health sector. So I pause here. Over to you, Naomi, for the recommendations.
Perfect. Thanks so much, Marco. So as we can see, there's really not that much money that is going to this cross-sector benefit right now, but there are, quite clear opportunities to increase this type of investment. First, and Marco already mentioned this, funds can work to create the conditions that allow for synergy. And this could be, for instance, the accreditation of health entities that would then open the door to greater health participation in funding requests. There's also a clear need for more guidance to countries and grant recipients on what specific opportunities and best practices there are for integrating climate and health across the range of currently fundable programs. And related to this, funds will ultimately need to create performance targets that incentivize this type of integration. And this could include, for instance, recommendations on the share of funding that has explicit co-benefit. There's also a lot that funds can do to raise awareness of existing opportunities for synergistic finance within their portfolios, as well as to proactively encourage climate and health proposals, and then work with technical and civil society partners to build that demand and also the capacity for that type of proposal development. And then finally, I think there's a lot of room for global health and climate change funds to be working with their counterpart funders and with other financiers like the development banks to look at how they might jointly invest in climate and health, and then to help their counterpart funders develop the strategies and policies that are reflective of mutual goals. Just quickly to note that within each of those areas, there are a number of specific recommendations for health and climate funds respectively. So for instance, on the health side, recommendations on how to bring climate change expertise into the secretariat level and within proposal review and technical teams. And then on the climate side, again, this idea of guidance and evaluation measures that incentivize the inclusion of health. And just a note on the climate funders, that would include both prioritizing direct investment in the health sector, as well as providing the guidance and incentives on how to maximize health benefits within investments made across all sectors, whether that's energy, transportation, agriculture, that can promote health if health is made explicit. And then lastly, and I'm just running through these really fast so that we can get to our panel, we've been talking predominantly about the big multilateral climate and health funds, but that's really just one slice of the financing pie. Development banks and bilateral donors are really going to be key here. They're already investing hugely in climate and health and could be doing a lot more to bring their siloed streams of finance together and bring their technical expertise to build that country demand and project pipelines. There's a need for more evidence, both building an investment case for synergistic finance, as well as the research on evidence-based strategies for this type of investment. The last piece Marco was talking about on the actual amount of synergistic finance, we found there's real limitations in the current tracking and reporting of financial data. So having better financial data systems and tracking would really increase accountability over time for donors to meet these climate and health goals. And then lastly, there are opportunities for advocacy to bring health more clearly into ongoing dialogues around climate finance. COP27 ended with this historic agreement to create a new fund to respond to loss and damage. And countries are also in the process of establishing a new global climate finance goal. And I think the health community could be playing a role in advocating both for those mechanisms to be fully funded in line with the true level of need, but also providing the evidence and advocacy on how climate finance can protect and promote health directly and through co-benefit. So that was kind of a very quick whirlwind. And if you want to read the full report, you can find it here, and we'll share the link in the chat as well. And with that, I'm really thrilled to move on to the panel part of our conversation. We have a wonderful lineup of speakers who represent a really broad range of perspectives on this issue. And so if all of you could come on video, Nicole Gorman is the Senior Policy Advisor at the Global Fund to Fight AIDS, Tuberculosis, and Malaria, an international financing and partnership organization with the mission of attracting, leveraging, and investing resources to end HIV, TB, and malaria. And Nicole is currently coordinating the Global Fund's work on climate change adaptation, mitigation, and environmental sustainability. Jean-Olivier Schmidt heads a global multi-donor program on health system strengthening at GIZ and has decades of experience working on health and social protection systems. Joe Thwaites is the International Climate Finance Advocate at NRDC, where he works to scale up international climate funding, shift financing to be aligned with the Paris Agreement's goals, and reform international financial institutions to be more effective at supporting climate action. And then lastly, but not least, Jenny Miller is the Executive Director of the Global Climate and Health Alliance, a network of national, regional, and international health organizations working to minimize the health impacts of climate change and maximize the health benefits of climate solutions. And so we're going to ask each of them to give brief 5-minute reflections. And again, please drop your questions in the Q&A. Nicole, I'm going to turn it over to you first.
Thank you so much, Naomi. And thank you very much for the invitation to participate in the launch of this important report, which is really helping us kind of focus the conversation around closing the financing gap for climate change and health. As Naomi mentioned in her opening remarks, it comes at a time when we're seeing a lot of climate-related emergencies, and we're seeing countries who have contributed the least to our climate emergency feeling acute effects of climate change in real time. Many of you have seen the recent news of Cyclone Freddy's devastating impact in Southern Africa, particularly in Malawi, where the Global Fund has invested over $2 billion in supporting HIV, tuberculosis, and malaria programming, as well as building resilient and sustainable systems for health. Climate change threatens the progress and investments that we have made fighting these 3 diseases, and therefore jeopardizes the core mission of the Global Fund, and the very reason why it was created 20 years ago to end the 3 diseases and prevent millions of deaths. Climate change will affect our collective ability to end epidemics and improve health. As a large multilateral funder of disease programs and health systems worldwide, we at the Global Fund recognize that we have an opportunity and a responsibility to support our countries mitigate and adapt the impacts of climate change within our mandate and to minimize our own impact. The Global Fund specifically aims to pursue action across 3 operational areas, which are outlined in our statement on climate change and environmental sustainability, which is on our website. And these 3 areas are secretariat, procurement, and country programs. As the report found, existing mandates provide opportunity for multilateral health funds to strengthen their coordination and collaboration. We agree that more can be done to better leverage existing climate finance mechanisms to address the impact of climate change on health. The report has several good recommendations, which are very helpful to start conversations, keeping in mind that these do need to be considered within the respective mandates of the different multilateral health funds. For example, the Global Fund, for those of you who are not familiar, has a country-driven model where countries prioritize how their allocations are used and often need to ensure the continuity of life-saving interventions before considering new areas to fund. Country prioritization, which is always very challenging, is going to be further impacted by fiscal constraints and macroeconomic challenges. This context makes the identification of existing priorities that have synergistic benefits for climate change mitigation and adaptation even more important. Health systems are an obvious opportunity for synergistic financing. Extreme weather events and economic insecurity affect the abilities of the health systems to deliver services to the people that they serve. It's therefore crucial that investments in health systems also consider how they can support resilience to climate shocks. We must also recognize that health systems are important contributors to greenhouse gas emissions and environmental pollution worldwide. So both multilateral health and climate funds should work together and really can work together to ensure that our investments are aligned in building and supporting low carbon and climate resilient health systems. Malaria is probably where we can clearly see some of the starkest impact on climate change on health. So changes in rainfall patterns and increasing temperatures are predicted to shift malaria transmission to areas that are not adequately prepared or resourced to prevent, detect, and treat malaria. This will require increased resources to provide interventions such as vector control in areas that previously did not require it because there was no local transmission. Programming for climate-sensitive diseases like those that are vector-borne needs to become more nimble and adaptable to the unpredictability that climate change is bringing. For malaria, this may include building data systems that facilitate the inclusion of relevant climate metrics to refine our stratification, planning, quantification, and the timing of the interventions so that they can be more responsive to climate-related events. Stronger, more holistic data systems that apply cross-sectorial views of our collective targets in a constantly evolving environment will need to take priority for investment. I'm not sure if many of you saw, but there was an article in The Economist this week, which really highlighted the impact of the drought in Somalia, where it's estimated that last year there was over 40,000 excess deaths due to the drought. Climate change is expected to continue to result in a significant food and water insecurity and contribute to forced displacement and migration, all of which impact our ability to provide services to populations, especially those who require long-term treatment and follow-up, like for HIV and tuberculosis. So service adaptations like telemedicine and multimodal dispensing of medicines are some approaches that require investment to ensure that services are people-centered for those whose lives will likely be disrupted by the impact of climate change. Translating priorities into action will require collaboration. Funding mechanisms will need to seek opportunities to collaborate with other partners to make funds available for best buy investments into climate resilient and low carbon health systems within the mandate of each organization and within the means that are available to them. We should look for opportunities together to leverage these different organizations so that funding can flow most efficiently to countries. Finally, there's a lot of momentum right now. It seems like every day in the news, we see something about climate and health. And there's a lot of calls for health to be an integral part of COP28 later this year. We as the global health community need to get serious about seizing the opportunities for these synergies in financing between health and the climate sectors. The report is a great step in providing us with more visibility into where those opportunities exist and to what the data is and where the data gaps are. It's important that together we work together to leverage our collective capabilities as supporting countries to build climate resilience and sustainability is something that we need to do together. Thank you.
Thanks so much, Nicole. It's wonderful to hear what the Global Fund is doing on this issue. Joe, I'm going to pass it over to you.
Thank you, Naomi, and everyone. And this is a really great report. I think, first of all, to say, the kind of data analysis that you've done is really, really useful. The OECD puts out a ton of data on ODA, but there's so much to pass through, and to do a deep dive on some of the intersectionalities between climate and health or climate and other elements is always incredibly useful. At NRDC, I work on public climate finance, international climate finance, and have had a focus on, particularly on multilateral climate funds. And so again, I think the paper is really useful. I like the way that you've broken it up in the what are the health recommendations for the multilateral climate funds and what are the climate recommendations for the multilateral health funds, because it goes both ways. And I in the writing I've seen previously on climate finance and health is tended to be for one or the other, and I think drawing those connections is vital, because you know, as Nicole mentioned, it's sort of both actors and the whole landscape have to be brought to bear on, you know, on tackling the immense health challenges we have, and of course, you know, the last few years have brought that front and center, but also on climate. And you know, it's sort of the key finding is probably not surprising, which is that there isn't enough funding for climate and health, and that the fact that it sits at this gap between where environmental funders and health funders are positioning themselves, there's always that tendency that things will fall through the gap. But one of the things that I find quite striking about having worked on climate for over a decade is that health is often how climate impacts manifest themselves. That communities are seeing the impacts of climate change very often first and foremost in terms of how it's affecting their health, and particularly in terms of local air pollution. So greenhouse gases, pardon me, greenhouse gases are affecting the global climate, but they're also causing a lot of local air pollution. And when we talk to communities around the world about what the challenges they're facing are, there's often a real synergy between tackling greenhouse gas emissions and tackling local air pollution, because fossil fuel power plants are the source of both of them, and that often the better entry point in many developing countries for talking about climate mitigation is to talk about the local pollution benefits and the health benefits that you can achieve from phasing out fossil fuel generation. But there are also some less obvious connections. For example, my colleagues in NRDC India have been doing a lot of innovative work on the intersections between climate and energy and the built environment when it comes to cool roofs and cooling in general. And obviously that's both a mitigation and an adaptation thing, but it's also a health thing, that as global average temperatures are rising, and in some areas are rising quite significantly, that is going to raise demand for air conditioning or for other sources of cooling. That's vital from a health perspective, but it's also going to raise the demand for energy. So I think there's a lot of intersections there that my colleagues in NRDC India have been working on, and looking at how, you know, if you're thinking through what's the most energy efficient way of providing cooling, that's a mitigation intervention, it's an adaptation intervention, and it's a health intervention. So there's a lot of potential for win-wins. The other thing I really like about the paper is the proposal of including climate experts at the country level in for example, the country coordinating mechanisms or other local level engagement when it comes to accessing health funds and to thinking through how to integrate climate and health funds. We've seen in general the integration of local experts, whether it's climate experts at embassies around the world of different governments, or in local expertise in aid delivery teams. Integrating that kind of climate expertise has been vital. Having someone whose job is to sort of think through the climate parts of an intervention is useful, but at the same time, you don't want to. There is always a risk with that of siloing, that you end up having someone. If you designate one person as the climate person, everyone else kind of goes, oh well, I don't have to think about climate. So I think that's the sort of one caveat I would have to that. But I think generally, you know, the more climate expertise that you can be integrating into other fields, the better. And then sort of, I wanted to sort of end with the discussion about health metrics. That a lot of the tracking of you know, one of the points the paper makes is that there's need for better metrics on how climate interventions can benefit health outcomes and how health interventions can benefit climate outcomes, and they're just not tracked a lot of the time. As I mentioned already, that climate action can have health benefits, but often it's indirect. It's the sort of local air pollution co-benefits. But tracking those can help make the case for how health funders can better integrate climate. And part of that, I think, is the need for data set integration, that bringing together data on climate, on health costs and adaptation costs can be really helpful in terms of figuring out where the synergies are, because oftentimes it's just a lack of data and a lack of tracking that is hampering the ability to sort of harness those synergies. And I think that's the, you know, part of that is like the valuation of climate and health costs and benefits, that where I've seen it in the climate funds, they're often not doing a great job of looking at those co-benefits. And so I think integrating some of that is really important. And then lastly, the climate health education hasn't got much funding, and I've seen a lot of students who are really interested in working at the intersection of climate and health, but it really hasn't been funded to a great degree. So I think that's an area where potentially philanthropies, where universities could invest more. And again, I think that's going to filter through in terms of having those technical experts, having the data analysis and tracking that we need.
Great. Thanks so much, Joe. And Jenny, I'm going to hand it over to you now.
Thank you, thank you, Naomi. Really interesting to hear the perspectives from Nicole and Joe. I'm really excited about this research and the launch of this report. And I do hope, as the others do, that it really helps to open up this conversation in a much broader way. GCHA has been, the Global Climate and Health Alliance has been working since its inception to increase the understanding of the climate and health nexus and to kind of engage and mobilize the health community on the issue of climate change in order to drive policy change at this intersection. And while there's still a long way to go, we're really seeing that awareness in the health community of the threat that climate change poses to health is just growing leaps and bounds, and also awareness of the opportunities for positive health outcomes and health co-benefits from climate action. And in addition, we're also seeing a growing response by the health community about the ways in which the health sector itself can be a contributor to the solution. We know as well that the health argument for climate action can be one of the more powerful arguments for making these changes, in part because of those strong health co-benefits, but also because health is where climate change really hits home for people. So over the past couple of years, GCHA has conducted an analysis of the nationally determined contributions, which are the reports that countries submit that articulate their commitments under the Paris Agreement. And they're required to update these every 5 years, set targets, et cetera. And so we conducted an analysis of the NDCs, as they're referred to, for all of the countries that had submitted updated NDCs, looking for integration of health into their plans across climate impacts, adaptation, mitigation, and finance. And while the country scores in our Healthy NDC scorecards, they ranged across the whole spectrum. Nobody got a perfect score, but some came very close. There were also countries that scored 0, had not integrated health at all into their climate commitments. But one of the interesting kind of trends that we saw is that some of the highest scoring countries in terms of integrating health into those commitments, climate commitments, were low income countries like Cambodia and Malawi. And, you know, our hypothesis about that is that these are countries that are seeing the impacts of climate change in real time, very powerfully, but with very limited resources to address them. And so that the health impacts of climate change are very present and very real for them. Through the Healthy NDC scorecard, we had opportunities to talk to representatives from some governments, to international partners that are working with governments. And something that we heard again and again is that even in countries where there's a high awareness of climate change as a health issue and as a health threat, governments lacked the resources to address that intersection. And when it comes to accessing some of the potential resources, such as climate funding for health projects, they really lacked the technical capacity to pursue that funding. You know, this is not something that I've delved deeply into, but in conversations with a health organization that is pursuing funding from the Green Climate Fund, it's not a small hurdle. It's quite complex to actually access those funds. So kind of, yeah, my takeaway from our work and from reading this report is that this analysis is really important at this time. It's particularly powerful, as both Joe and Nicole have noted, that this is framed as looking for synergistic opportunities through this funding and looking both at climate funding and health funding. I think one of the, again, in our advocacy for integration of health into climate action and vice versa, some of the pushback we get is, you know, there's just not enough money. We're resource constrained. We can't do it. You know, I think I take that reaction with a grain of salt. We seem to be able to mobilize resources when we want to, but at the same time, it's really, really important that when we're investing public resources, we do so in ways that really get the most bang for the buck, and both public and private resources. And so I think the recommendations from this report are really powerful and really important. I also want to kind of acknowledge and raise up again what Nicole mentioned, which is that this year in particular, there is a very large focus on the intersection and the nexus of climate and health. And that's because it will be, for the first time, a much larger focus at COP28 than it ever has been before. The COP presidency is making it a priority issue. It is a real opportunity to elevate these issues. And to reiterate Nicole's call, I think it's really important for the health community to work together to kind of drive that conversation in the right directions. So delighted to welcome this report, really strongly endorse the recommendations. And I very much hope that it opens up the conversation around these issues much more broadly with a lot of partners. So thanks, Nicole, and Marco, for this excellent report.
Great, thanks, Jenny, and thanks, everyone. Again, if you have questions, please do drop them in the chat. We're running short on time, but probably have time for a few. And I'll just say that one question that has already come up is, you know, where stakeholders might go to engage in this type of advocacy. And so maybe we can just do a quick round robin to our panelists, thinking about, you know, if you had one message for funders and one message for the community of advocates on the call who are interested in getting engaged, you know, what would you say to them? What's the next steps? Where should we be looking and turning our attention? And maybe just everyone kind of do your quick one sentence call to action And Jenny, I'll just start with you and we'll go backwards.
Putting me in the hot seat.
Yeah.
I think that, in terms of moving the multilateral funds, and I'm thinking especially in the climate space, we just have to keep incorporating the call for the integration of health into climate financing of all kinds, whether that's mitigation funding, adaptation funding, the loss and damage funding that we very much hope will be funded in the near future. That needs to be embedded in all of our kind of submissions through the UN policy process, our advocacy around these issues in public. It needs to become part and parcel of what we're calling for, which is the the integration of health into climate funding. I don't have as clear a sense on how the global health funds are moved, so I'll leave that to the other panelists. But I think there are, one of the other things that we found in the NDCs is that countries on the whole are not thinking about health and talking about financing and economics around climate change. And so I think there's a much more broad-based role for advocacy that kind of puts these three things together, thinks about climate change and health as synergistic opportunities, and that they need investment.
Great, thanks. Joe, quick thoughts?
Sure, yeah. I mean, I think one of the things the paper made the point on was that the climate funds tend to have fewer mandate constraints. But I think that's a blessing and a curse in some ways, because it's a blessing and it allows them to be flexible and to invest in across a variety of areas, including on health, although they are, as seen, not doing that to a large degree right now. But it is a curse as well, because they're being asked to do everything. They're being pulled in so many different directions. Meanwhile, the health funds are sort of very focused, often on a few challenges or particular diseases. And one of the things that I've observed, and the data shows quite clearly, is that health funds, multilateral health funds, get far more donor money from rich countries. And not to minimize the amount of effort that takes, that fundraising is still a really heavy lift, but the multilateral health funds are getting quite significantly more than all the multilateral climate funds combined. And so while I agree that multilateral climate funds need to be doing more on health, there's also this question of are there lessons that we can be learning for the multilateral climate funds from the health funds fundraising efforts and how they've worked? And I think some of the ways their boards operate, some of the ways that they take innovative and alternative sources of financing are really interesting, and that haven't really been trialed to a great degree by the multilateral climate funds. So I think there's some lessons there. But also I spend a lot of time on the Hill in the US advocating towards Congress to appropriate more money for climate. They appropriate about $1 billion a year for climate, and they appropriate over $10 billion a year for health funding. So the other question is, if we're talking about advocacy and what advocates can do, I think talking to the health community about, are there synergies? And the worst thing, the thing that I absolutely do not want to see, is money being diverted from urgent health needs to do solar panels or something like that, because frankly a lot of investment in solar panels can be done from the private sector. But I do think there is a useful conversation that can be had about, are there areas, particularly around adaptation, where the health funding, which frankly is less politically contentious than climate, certainly in the US, are there areas where that can be used in a way to get some climate co-benefits without obviously putting that funding in jeopardy. And so it's a fine line to walk, but I think that there's that will be something I think that advocates could explore.
Yeah, that's a fascinating point and a good one to remember. And maybe with that, Nicole, I'll turn to you for just a last thought as a health funder.
A lot's been said, and just, I mean, so thanks to both Jenny and Joe. So I think you asked for two things. So for advocates, I think we'd say help us center health within the climate change action messaging. Let's get health, let's keep it a focus. It's great that that's happening, but let's make sure it stays there. And I think for, I'm thinking about the climate funders and even the health funders, we need to find ways to collaborate and really leverage our different expertise and look for these different opportunities where we can have impact. And, for something like the Global Fund, we have a lot of existing mechanisms in country. We demonstrated with the COVID-19 response mechanism that we can also adapt and channel resources quickly, effectively, and efficiently. So let's look for opportunities. Let's not duplicate. Let's try to find the thing that's most efficient, because at the end of the day, we want it to work for the countries. Sometimes we see countries being pulled in many directions and to respond to different things. So let's look for ways where we can leverage the collective. And I think that's something that we can't do this by ourselves. We all need to work together. And if there's opportunities, we should really look for those. And I think this is a really a nice conversation to start. And, having this report is very helpful. And then I think I hope it's the beginning of a really, rich and fruitful conversation. So thank you.
Yeah, thank you. And thanks to all our panelists. We are out of time, but I do want to say there are a few questions in the Q&A. So panelists, please feel free to answer those or drop your thoughts for our speakers, and people who have other questions, feel free to add them. We'll try to answer them in the chat. I do want to turn to just our last speaker for the day, Martin Collier, who is the Executive Director of the Glaser Progress Foundation, and he will be giving us just some closing comments, the perspective of philanthropy in this arena of synergistic finance. So Martin, I'm going to turn it over to you to close us out for the day.
Thank you, and hello all. I come at this from the private philanthropy perspective. This is a very important report from that perspective. It lays out a very rigorous, thoughtful, and helpful blueprint for further investment. However, I think it's important to remember that this is a starting point for further and next steps. If we're going to turn this blueprint into meaningful action, it's up to all of us in this session, particularly funders, to do that. I want to give you my perspective, why I think the intersection of health and climate change is so important. And I'll give you several reasons. First is conceptual. The architecture that we've built, the siloed architecture that we've built, is to a large extent artificial and doesn't reflect the reality of some of the issues that we're facing. Most of the solutions to the most pressing problems that we face on the planet lie not within discrete disciplines or within discrete silos, but those solutions lie at the intersections. And I think the prime example of that is both climate change and health. Second, I think the intersection between climate change and health is enormously powerful with respect to building more effective advocacy and communications capacity. The photos we see in newspapers and on the web around the world of climate disasters, weather disasters, are really the faces of public health emergencies. Displaced people without homes, people standing in line for water, food. These are the faces of climate change. In addition, the proliferation of messaging that we're all faced with has raised the stakes with respect to messengers. In some ways, the messenger has become more important than the message itself these days. The intersection of climate and health provides an opportunity to bring in a whole new set of credible, trusted messengers on both sides of the equation. Health leaders, doctors, nurses, and so forth are some of the most credible, trusted messengers that we have available. The third reason I think it's so important is the fact that the financing leverage. As an example, I'll point to the Global Fund to fight AIDS, tuberculosis, and malaria. It's unfortunate in some ways, ironic in some ways, that crises drive investment. But that investment can be leveraged in addition to fighting the 3 diseases in the case of the Global Fund to building permanent long-term healthcare infrastructure that will last long beyond, hopefully, the eradication of those diseases. And that piece of it is essentially, it is enormously important. And it is clear that climate change, because it functions in many ways like a pandemic, will be the next wave, will generate the next wave of investment. Lastly, but most importantly, the reason why I think it's so important is equity. There is no better lens for revealing and demonstrating the inequitable impacts of climate change than the health lens. It reveals that the most vulnerable populations are least responsible for creating the context and for the crisis. And that piece of it is absolutely imperative for driving solutions for the most vulnerable populations. In terms of the report identifies at least 4 categories of investment from the perspective of private philanthropy for investment. The first is education and further research. Again, the report is a starting point. There is much more to do with respect to educating funders and vulnerable populations, and also in terms of further research to bring the recommendations of this report forward. The second category is access. The financing mechanisms that sit at the intersection currently and that are currently being developed are enormously complicated. And providing, particularly for vulnerable populations and vulnerable countries, technical support to access and navigate those financing funding mechanisms are absolutely essential. Like all of the participants on this panel, I am sure, I am a subscriber to the notion that the solutions should be country-driven, vulnerable population-driven. But there is wide opportunity for providing support for those populations and countries to access through funding proposals to access the existing and new financing. The second, the third category is implementation. And again, there is a dramatic need on the funder side to provide support for implementing effectively the projects that are funded. And the fourth category, which I think is the most important, is creating success stories. Nothing, and I mean by success stories, successful projects that are undeniable and absolutely measurable. Nothing begets further success and further investment like success stories. Success stories also have the potential to really transform the narrative around climate change. And I'll close with, I have 3 more comments, really geared towards private foundations and private funders. The first is we have to remember that we're not only accountable to our donors, but we're accountable to the populations that we serve. And that tends to be the most vulnerable. And that makes it incumbent on all of us to test, re-examine, and challenge the mandates under which we exist, particularly when those mandates are siloed. Also, we need to take risks. In my opinion, philanthropic dollars should take the largest risks. They should lead the way, and in terms of creating proof of concept and successful outcomes. The second comment is that I think the report reveals clearly that integration is already occurring. It's not a question of whether integration is going to occur or will occur. It definitely will. What is driving integration are not funders, but what's driving integration is climate change. As I said, it functions much like a pandemic. So the question for funding is not whether to integrate, but how to catch that wave and accelerate that wave. My final point is about language. I have attended a number of conferences where the effort has been to connect climate funders and health funders. And one of the things that I have been struck by is that they speak in different languages. If we are to pursue this intersection, and which we are going to pursue, the question becomes, what is that common language? How do we bridge the languages between these silos? And I think, again, foundations, private philanthropy can lead the way through collaboration between climate funders and health funders in developing that common language. And with that, I want to thank you, Naomi, for including me.
Great. Thanks, Martin. And thanks to everyone who joined us today. This was a fantastic session. Lots of food for thought. And like everyone said, I think this is really the beginning of a really important conversation that hopefully we can all take forward together. So thank you again to everyone for joining, and please do stay in touch with us. We hope we'll be advancing this report findings together. Bye.